Good morning, everyone. My name is Tim Hogan. I'm the president of Riverview Medical Center. Thank you for joining us at Hackensack Meridian Health's Riverview Medical Center this morning. We're very pleased that you're here, very proud that you are here joining us at one of the top providers of healthcare in the state of New Jersey. It's also my pleasure to introduce a very good friend and a great neighbor, Governor Phil Murphy.
Thank you, Tim. Thank you very much, Tim, for your very nice words. I am a neighbor. I live across the river. I sometimes hang my hat over in a building over there when I'm not in Trenton. So honored to be here, and thank you for having us. It is a pleasure to be joined by our commissioner, and you're going to hear from her in a few moments, of the Department of Banking and Insurance, Marlene Caride. Marlene, it's great to have you here. To her left, Health Commissioner Dr. Sharif El-Nahal. Sharif, honored to have you. Our Human Services Commissioner, Carol Johnson, behind me. Carol. And last but certainly not least, Senate Health, Human Services, and Senior Citizens Committee Chair, Joe Vitale. Joe? Assemblywoman Serena Damaso is in the front row, Monmouth County's own. Serena. Assemblywoman Nancy Pinkin is in the house. Great to have you, Nancy. And among others, Red Bank's own Eddie Zipprich. Ed, great to have you, man. So we're here today with some good news. That's probably the most important thing I'm going to say. Because of the steps that we have collectively taken since the beginning of this administration to stabilize our individual health insurance marketplace, and despite President Trump's efforts to destabilize it, New Jersey residents are going to see rates significantly lower, an average of 9.3% lower when they go to purchase a similar plan in the year 2019. I want to thank, and I can't stress this enough, Senator Vitale for his leadership in this as a champion for health care consumers. So thank you, Joe, for everything you do to lead the way here. They are not here, but I also want to give a shout out to Senator Troy Singleton and Assembly members John McKeon, my cousin Carol Murphy, that's not true, but I have to say it, Pamela Lampett, and Dr. Herb Conaway for their invaluable work in this effort as well. Each of us recognizes the need to ensure every New Jerseyan has an affordable health care policy that works for them and their family. This has guided our efforts. We know that the best way to do this and to contain costs is to lower the number of uninsured residents, provide stability in the marketplace, and ensure that every eligible person has a policy that suits their needs and budget. Yet these realities have fallen on deaf ears in the Trump White House. With President Trump and his Republican enablers, both in Congress and in state houses around the country, continuing their assault on the Affordable Care Act, it has inevitably fallen to us to act in the interests of our residents and consumers and in the name of common sense. In one of my first acts as governor, I issued an executive order for our state agencies. Get on that, Sharif, please. I'm not qualified to take that call, but you are. So one of my first acts as governor, I issued an executive order for our state agencies to make a greater effort and to work in concert with nonprofit partners to ensure that every eligible New Jerseyan knew of their options under the Affordable Care Act. We will sign up as many residents as possible, but that was just a start. This spring, I signed into law, and this is really important for the results we got today, 2 measures which are bringing rates down for hundreds of thousands of New Jerseyans. And again, I want to give Joe a particular shout out. The first created an individual mandate for coverage in New Jersey that was part of the Affordable Care Act. Last year, President Trump and Congress eliminated the Affordable Care Act's mandate at the federal level and thereby destabilize the healthcare marketplace as part of their, I'm going to call it, disastrous tax plan. Not just content with hiking taxes on New Jersey's families, President Trump decided to also try to hike their health insurance rates. The second step we took, and by the way, we were the first state to create that mandate after that tax plan. And I believe Massachusetts is the only other one that has it, and they had it way back when Governor Mitt Romney was leading Massachusetts. And by the way, this is an idea that originally came from the other side of the aisle. So it's important to note that this is not all partisan. The second step we took created the New Jersey Health Insurance Premium Security Fund. This fund, which is mostly made up of federal dollars, will help reimburse insurers for the claims, in particular of the catastrophically ill. This provides a level of protection against those claims spiking premiums for the rest of us. 3 weeks ago, thanks to Marlene's great work and her team, the federal government signed off on the waiver that we sought to implement and manage this fund. And today, Marlene will has signed the waiver this morning, has signed the waiver on behalf of the administration. So that's a lot of technical and legal sounding lingo. But what does it mean for New Jersey's healthcare consumers? One word, period, full stop, savings. Had we done nothing, had we let President Trump's plan continue unchallenged, healthcare consumers in the individual market would have seen their rates increase by 12.6% from last year. So 12.6% more this year for the same plan that they would have had last year. Again, however, because of our actions, when the carriers in the individual marketplace submitted their 2019 rates to Dobie, the group that Marlene runs, these two measures combined to decrease rates by an average of 9.3%. For those of you math majors out there, that's a swing of 21.9% for the good guys. To put this in terms of dollars and cents, let's take, for example, a New Jersey resident who purchased a silver plan on the individual market for a monthly premium of $350. Had we done nothing, that $350 would have turned into $394 for 2019. But now that plan will only cost, round numbers, $314. Or put another way, because of this work, instead of spending an additional $528 in 2019, that consumer purchasing that plan will now save about $422. That's a swing, not just in percent, but it's a swing of $950 year over year. And that is real money, and that is welcome news indeed. Moreover, it is savings that, bless his heart, our president didn't want you to have. And it's because of this that the Center for American Progress just named New Jersey as the #1 state in the nation in standing up to the, and I quote them, the federal ACA sabotage. I also want to give some thanks to some other folks. And first of all, again, I want to thank Riverview for hosting us and the extraordinary professionals that come here every day. And for those who count themselves as members of HPAE, a particular shout out to you all. I must also give thanks to the hard work of Ray Castro of the New Jersey Policy Perspective, Citizen Action's Dina Matola-Jaborska, Princeton University's and former commissioner and a dear friend of health, Heather Howard, in row one sitting in seat 1B, and Tyler Hausman of the New Jersey Health Care Quality Institute, among others, to make all of this possible. New Jersey is not buying into the false idea being pushed by the president and his ilk in Washington that the best health care policy is to just not get sick. We don't believe that offering bare bones coverage worth little more than the scrap of paper that they're written on is in any way sufficient. New Jersey is going to prove that when you stick to the tenets of the Affordable Care Act, you actually end up with more affordable health care. We're taking this challenge seriously and head on. And because we are consumers are seeing real and substantial savings. So thank you for that. I would now like to introduce, again, a guy who has been extraordinary in leading the charge on health care across the whole gamut for long before I got here, my friend Senator Joe Vitale.
Thank you. Well, thank you, Governor. And, there's lots of thanks and acknowledgments and people thanking me for all this work. And I got to tell you, I wish it was that I woke up one morning and had an epiphany that we could reduce health care premiums by that much. And make sure that individuals in New Jersey had affordable health care coverage. But it took a team effort, and the governor mentioned earlier that this is really a bipartisan effort in the legislature where the bill passed, and around the country where it is that states like Wisconsin, with Scott Walker, well-known Republican, and Oregon and some other states with Democratic leadership really came together to make sure that their first principle was to be able to provide affordable health insurance and find creative and unique ways and innovative ways to do it. And they did. And so we learned from them, and Heather Howard from their Princeton think tank, synonymous with Princeton and think tank, came to me with the Quality Institute with these ideas as well, with the department to write the legislation, to make sure we got it right, to make sure that we work with the Department of Banking and Insurance and Commissioner Caridi and others, that every word, every T was crossed properly, every I was dotted, that we can get this through Washington and their approvals. Because at the end of the day, the two bills that the governor signed are significant in terms of providing that coverage. All of us know we're in this business. I want to thank the President for hosting this and those who are here from the hospital, how important health insurance is for facilities like yours, but individuals who come here. And the first bill, which was the mandate bill that required everyone in New Jersey to have that insurance, is significant because if it is that everyone isn't in the pool swimming in the same direction at the same time, it just makes it unaffordable for everyone else. And it's also not fair for those who could afford to be in insurance to pass on it, so that the rest of us pick up the tab, and hospitals like Riverview and others wind up with significant charity care obligations. So it's a fair process that gives people the opportunity to enroll. If they don't, of course, there's a penalty that goes into the bucket of money that pays for the health care reductions, as well as the federal dollars. And I'll leave the numbers up to Commissioner Caridi, who was a better math major than I was. But just suffice it to say that this was a team effort. I want to thank Commissioner Hall and Commissioner Johnson, because with all of the commissioners who are here today are part of the very important team in Trenton that sort of think through, operationalize, and improve the healthcare system in New Jersey for all different parts of the spectrum and the program. So I'm grateful that they're here. I'm grateful for the governor for signing the legislation and being a true champion and leader on the issue. Thank you, Governor.
Thank you, Joe. Well said, I know Joe believes this in his team, and he's got an extraordinary team. We have several former legislators in senior positions in our administration, and Marlene is one of them. And when you're trying to bake something as complicated as this, that really helps because there's a simpatico and understanding of how you go through the legislative process. So without any further ado, the Commissioner of the Department of Banking and Insurance, Marlene Caridi.
Good morning, everyone, and Governor, thank you. A 9.3% decrease in health insurance rates for next year. That is the result, thank you. That is huge. That is the result of the actions that we have taken in this state today. These are real, tangible results for the residents of New Jersey. We are fortunate to have the leadership of Governor Murphy, who has committed himself to fighting for access to coverage and care for families in this state. Under his leadership, we have proven that a state can defend against the actions in Washington aimed to undermine the ACA. More than that, we are proving that it is imperative that states step up and defend access to care. We know that states across the country are increasingly challenged in their efforts to ensure residents have access to quality and affordable health coverage, as well as protecting against disruption in the market. Here in New Jersey, we did not back away from the challenge. On the contrary, we met it head on. When I took my position as commissioner, Governor Murphy said it was his priority to act aggressively and proactively to improve the health insurance market in New Jersey. I was and am a willing partner and committed partner in his vision of providing residents access to quality and affordable coverage. Under his leadership, the process for creating a reinsurance program was advanced, and today, at the governor's direction, I had the privilege of signing the program contract and submitting it to CMS. It is done. It is submitted. In 2017, health insurance rates in New Jersey's individual market increased by 8.7%. Last year, in 2018, they increased by an additional 23.3%. As a result of our work and the support of the legislature and our partners who are here today who advocated for these measures, next year we see rates decreased by 9.3%. So congratulations to everyone here that worked hard to make sure that New Jersey residents had quality and affordable health care. This is a major progress for New Jersey, and contrary to experiences of other states in our nation, which are seeing requests for double-digit increases in rates. We are committed to continuing our work in defending access to coverage and affordability here in New Jersey for our residents. Thank you.
Well done. I think we're going to take a couple of questions, if that's okay. We won't hold you long, but is that okay with you, Dan? Anybody? Please. Yeah. I mean, first of all, let me just start with a headline, which you've heard me say many times. We are as far from this Washington administration as you can get as it relates to immigrant rights and security and their aspirations, whether it's dreamers, whether it's people unlawfully getting their families ripped apart. It's a politicization of a government organization unlike almost any I can think of. I'm the former U.S. ambassador in Germany. It's one of the biggest missions we have in the world. There are probably 40-something government agencies in that mission. One of them is ICE. With the proper civilian leadership and directed properly, there's a role for them to play. It has been entirely politicized, and I can't say that more strongly. I've only read the report. I was actually in Hudson County last night, but it was a political event, so I wasn't deep down in the details. It feels like a step in the right direction, but I also can appreciate the fact that a lot of folks feel like they want an answer in the here and now. It's a county decision. I need to understand it more deeply. But again, we are on the side of immigrants, period, full stop in this state. Can you hold on one second? I'm just going to do, by the way, I want you to introduce you to him because he can answer the question you're going to ask me earlier. Anybody else? Brent?
We now go to your house and get lunch.
Joe asked me if I rode over, which I did not. I have my running shoes on, though. I appreciate the thought, Brent. But they are all birds.
I can never tell. I really don't know. I just tweeted that. So.
Yeah, these are all birds, yeah. And we'll take a rain check on lunch, though. I'd love to do that at some point. Sir.
What happens in New Jersey if a Texas judge decides to eliminate pre-existing conditions in California?
Any thoughts? It'd really stink, first of all. I mean, the fact that we're even talking about this is extraordinary. Now, I don't know what the actual practical impact would be. Does anyone know?
The reason why New Jersey is involved in that litigation is because we need to protect our residents. And it's not just New Jersey residents. You have states all over the country that are involved in that litigation, protecting the ACA. If that decision were to go against us, then we are looking at having larger numbers of individuals uninsured, and that would not be good for the residents here of New Jersey. It would be very costly.
Just to add to that, comparing notes with Joe and Carol, would probably do a version of what we're doing today. Would figure out, I wasn't really I had low expectations for this guy, but he has managed to undercut those expectations meaningfully. I wasn't expecting we were going to have to create a mandate at the state level, but it turns out we had to. So my guess is that all the group up here and our teams would roll up our sleeves and try to figure out some way to compensate or mitigate.
What's your reaction to the Attorney General's announcement yesterday of a task force investigating abuse claims in the Catholic Church?
I mean, given what's gone on, it doesn't surprise me, first of all. I've said to some of you the other day, I'm completely and utterly sickened as a governor, as a dad, as a Catholic, by all that we've seen, and most recently coming out of Pennsylvania. I'm not surprised, but beyond that, that's the Attorney General's call, and I'd defer to him to get into any more detail on that. You good? Okay, are you going to ask me the question that you asked me downstairs?
No.
Okay, sorry.
It's about the insurance
Favorite color?
It was about the insurance companies and
Okay.
their denials of pre-existing
Right.
conditions. What's to say that the insurance companies are going to alter the plans once this has been instituted?
Well, at the end of the day, the way at least we've constructed it in New Jersey is this is a stable market, and that's what the insurance companies want as well. So healthcare consumers want them, but the insurance companies want a stable market and some amount of visibility, or otherwise they can't plan. And the more volatility that is put into the system, the less likely they're going to continue to participate. What we've done today, what I think we've tried to do collectively, is to put stability back into this, which gives them confidence to be able to participate at rates that are acceptable. You've also got a reinsurance element here, which we sort of glossed over, which clips off the catastrophic piece of the bell curve, which allows the rest of us to not have to bear that burden in our own premiums. Eddie?
Governor, is the idea to, in stabilizing the market, make insurance more available to those uninsured or not insured in the state?
Yeah, this is all of the above. And if you look at the collection of the actions that we're taking, we're trying to make it, if you've got insurance, to make it more affordable. But we also have a very robust plan. You know, again, I don't want to keep being hypercritical, but this Trump administration has cut the enrollment period dramatically, and they've cut the funds that underpin the advertising around that enrollment period. They've gutted it. So we, early in the first days of our administration, put an executive order out that we're going to promote the enrollment period far and wide. And that is, in some cases, for folks who have insurance, but in many cases, if not most, for folks who don't have it. So it's a collection of actions which hopefully do both of what the premise of your question. Makes it cheaper if you've got it, and gets you insurance if you don't. Fair? Thank you, everybody. Again, thanks to Riverview for hosting us so graciously.